Okay, and welcome back. I'm going to bring your attention now to some research in the last, 7 to 10 years, or really in the last 7 years, really, that have shown us that sometimes the standard dietitian approach to diabetes um, can be improved upon by some dietary manipulation and the addition of strength training exercise. So the research is moving in a new direction right now. It doesn't mean that the dietetic version is the wrong version by any means, but it just may not be the only approach. So this study in Diabetes Care, the journal Diabetes Care in 2010, was very eye-opening. It was a research study testing a high protein, low calorie and low carbohydrate diet with and without resistance training. So some of the people did resistance training and others didn't. So the diets were designed to be isocaloric. That means that everybody in the study ate the same number of calories a day. And it was moderate energy restriction. So the women were having no more than 1,400 calories a day, and the men were having no more than 1,600 or 1,700 calories a day. And one group was given sort of what's called the Con diet. That's sort of the high carbohydrate standard dietitian type diet for diabetes. That was 53 total calories. 53% of the total calories was from carbohydrate, 19% from protein, and 26% from fat. So that's sort of the standard dietetic approach to diabetes management. And in the high protein group, they lowered the carbohydrate intake down. They gave them a higher protein diet, so the protein was 43%, the carbohydrate intake was 33%. 43% carbs, 33% protein, and 22% fat. So they lowered the carb intake by 10%, and they upped the protein, and the fat was just a little bit lower. And so what we saw in this study was quite interesting. They also gave a subgroup of the people who were on the high protein, lower carb diet strength training exercises to do. They gave them 8 separate exercises: the leg press machine, the knee extend machine, chest press, shoulder press, lat pull downs, seated row, and tricep presses and sit-ups. So they got these strength training exercises that were performed using weight stack machines, so these sort of select drive machines, except of course for the sit-ups, and they did it 3 times per week. The weight load that they used was 70 to 85% of one repetition maximum, which is determined for each exercise right at baseline. And this allowed for about 8 to 12 repetitions to sort of volitional fatigue, where they really felt like they couldn't do another rep, with 2 sets per exercise and a 1 to 2 minute rest between sets that they were performing. So standard way of sort of doing strength training, about 8 to 12 reps, using a 70 to 85% of the amount you could lift one time, but being able to lift that now 8 to 12 times. And as they got stronger, they increased the weight. So they applied that overload principle of weight training. So as the person got stronger, they made the weight a little bit heavier. And the resistance training sessions took about 45 minutes, 3 times a week. So these are the results of the study. Participation in the resistance training group produced greater weight loss and fat loss and increased muscular strength compared to just energy restriction alone, regardless of how the energy restriction was applied. So it burned more calories, lost weight, lost body fat, increased their muscular strength in that period of time. Additionally, the replacement of some carbohydrates for protein further magnifies these effects, resulting in the greatest reductions in weight, fat mass, waist circumference, and decreased blood levels of insulin. These are all really positive outcomes. All treatments had similar improvements in the glycemic control and cardiovascular risk factors. A lifestyle modification program combining an energy-restricted, high-protein diet appears to be, with the resistance training, appeared to be a preferred treatment strategy in overweight, obese individuals with type 2 diabetes. Further studies should evaluate the longer-term effects. So this was a short-term study over a number of weeks, but it really suggests that higher protein, lower carbs, some restriction in total calories combined with strength training using this protocol had quite a dramatic effect on getting some of these parameters into a more ideal range. Good improvement in reduction in body weight. So there was a reduction in body weight that was very significant. They lost 13% of their body weight on average versus 9% in sort of just the standard diabetes management diet. High carbs and lower fat was around 9%. So just by restricting calories, no matter how you do it, body fat's coming down. But they got better results using the high protein diet with the strength training. The high protein diets have potentially adverse effects on renal function, and that remains a concern. So the question is, if you start increasing protein too much, it creates more of a solute load on the kidneys, and it may actually cause some kidney damage, and of course diabetics are very prone to kidney damage. However, in this study, although it was short term, there were no differences in creatinine clearance, and there was no presence of microalbuminuria between the diet groups that was observed. So they didn't seem to actually damage the kidneys, but again, this is not a long-term study. So nevertheless, diabetes is associated with impaired renal function, and the longer-term effects in this patient population warrants further investigation. You can't just assume that you can take diabetic patients and give them more protein and strength training, and you lower their blood sugar and their weight comes down, their body fat's doing better, unless you're monitoring their eGFR, their estimated glomerular filtration rate, and their creatinine levels to see if there's some kidney effects going on. Then that's not highly responsible. Other studies have been done using the ketogenic diet in type 2 diabetes. So a ketogenic diet is much higher in fat and protein and very low in carbohydrates, and dramatically lowers blood glucose levels even in type 2 diabetes. So if you really want to get your blood sugar down quickly, you put the person on a ketogenic diet where they have very few carbs in the day. Now, this diet was first created back in 1924 because ketogenic diets can be very helpful in raising the seizure threshold. So for these intractable seizure disorders in children, they can put them on these ketogenic diets and it can help stop the seizures. So now in recent years they've been applying this to see how it works with type 2 diabetics. So the ketogenic diet may improve blood sugar levels while also reducing the need for insulin because the carbohydrate intake is so low. However, the diet may come with some risk factors, so it may not be suitable for all diabetics, especially if there's already some concerns about renal function and liver function. So many people with type 2 diabetes are overweight, so a high-fat diet can seem unhelpful. The goal of the ketogenic diet is to have the body use fat for energy instead of carbohydrates or glucose. So if you can get the person burning those excess fats that they're storing, then that's a great thing. A person on the ketogenic diet gets most of their energy from fat, with very little of the diet coming from the carbohydrates. And when we're in a low carbohydrate state, remember that, as we talked about in Essentials of Metabolism Part 1, a lot of the fats that the ketones, the extra acetyl coenzyme A in the liver is going to condense into ketones, a water-soluble form of fat, and much of that can get urinated out of the body. So you're actually urinating out fat in a very low carbohydrate state. The ketogenic diet doesn't mean that you should load up on saturated fats, though. Heart-healthy fats are the key to sustaining overall health. So some people go on a ketogenic diet, start having all kinds of red meat and mayonnaise, high-fat cheeses, and so on. And this can do a lot of damage, clogging the arteries. It's not something I would advise. If a person's going to move towards a more ketogenic diet, then you want them having healthier fats. So they can use egg whites. It's not like crazy about them having egg yolks. And they can have fatty fish, cottage cheese, avocado, olives, olive oil, nuts and nut butters and seeds. These things all have a lot of fat in them. Can be used as a fat source. while the person's trying to keep their total carbohydrate intake low. So what's the effect on blood glucose? Well, the ketogenic diet has the potential to decrease blood glucose levels very dramatically, lowering medication doses or eliminating them. If blood sugar drops too low, the patient can end up with hypoglycemia. Then there's not enough glucose for the brain, so they fall down, they hit their head, and they have a concussion, or they develop a fracture, a hip fracture. And this is why all members of the patient's diabetic health team must be aware of any diet or lifestyle change you may initiate with the patient. So if you're determined to get the patient onto a ketogenic diet or a carbohydrate restricted diet that's significant, then the person's already often on medications trying to lower their blood sugar and increase their insulin secretions. So when you start compounding those effects, sometimes blood sugar drops so precipitously that they become hypoglycemic, and then they become dizzy and they fall down. They can hit their head, have a concussion, have a major fracture. So if you're going to attempt that with someone, it's vitally important that you communicate what you're doing with the person's other health care providers around their diabetes, so they can be prepared to make adjustments around the medication that they're providing to the person and monitor the individual a little more closely. So by switching the focus to fat, some people experience reduced blood sugar or even hypoglycemia when combined with glucose-lowering medications. So that's the point, that still they're often still taking the same medications, but now their diets change so dramatically that the drugs amplify the effects of the ketogenic diet or the very low carbohydrate diet. So a classic low carbohydrate diet, of course, is the Atkins diet. It's one of the most famous ones. It's low in carbohydrates, it's high in protein. It's often associated with the ketogenic diet. However, the two diets there's some differences. The Atkins diet was created in the 1970s by Dr. Robert Atkins. It's often promoted as a way to lose weight that also controls numerous other health issues, including type 2 diabetes. And again, it's restricting those starchy carbs. They disappear from the diet, and refined sugars. While cutting excess carbs is a healthy step, it's not clear if this diet alone can help diabetes, although I think it's a step in the right direction for a lot of people. But weight loss of any kind is beneficial for diabetics, and high blood sugar, whether it's from the Atkins diet or another program, anything you can do to lower blood sugar is usually going to be beneficial, as long as you're not damaging kidney function and the proper monitoring is in place. But unlike the keto diet, the Atkins diet doesn't necessarily advocate increased fat consumption. Still, some people increase their fat intake by limiting their carbs and eating more animal protein. So this is where they start switching, and they have red meat and lamb and spare ribs, and they start loading up on these animal proteins, which can be very challenging for the kidney to deal with, and the liver, and produces a lot of fat that makes the blood very sticky and can raise lipid levels in the bloodstream and cholesterol. And so I'm not a big fan of applying the Atkins program that way. If they're using chicken, turkey, fish, avocados, seeds and nuts and beans and peas and olives and olive oil, then I think this is a smarter way to apply a diet like this. The potential drawbacks are similar. Aside from a high saturated fat intake, there's also the possibility of very low blood sugar or hypoglycemia from restricting carbs to an excessive degree. This is especially true if they're taking medications to increase insulin or to lower their blood sugar, increase insulin sensitivity. So cutting carbs on the Atkins diet can potentially aid weight loss and help control diabetes symptoms. But there aren't enough studies to suggest that Atkins and diabetes control go hand in hand. There hasn't been enough, large randomized trials that you can say 100% for sure this is the best possible thing you can do. But if a person's going to do it, and I'm not saying they can't, just the monitoring has to be in place. These are the potential dangers. Changing the body's primary energy source from carbohydrate to fat is going to increase ketones in the blood. Whenever you have too many ketones, you may be at risk for developing diabetic ketoacidosis, which is actually usually more prevalent in a type 1 diabetic when their blood sugar is out of control usually very high blood sugar, and the cells can't access it, so they're burning fat very, very rapidly. Although rare, diabetic ketoacidosis is a possibility in type 2 diabetes if ketones are too high. And when you go onto a ketogenic diet, those ketones might rise into a level that it could be dangerous for the person, and especially if the person is ill to begin with and then they go on a low-carb diet, ketoacidosis can occur much more easily. So if they're on a ketogenic diet, patients should be aware to test their blood sugar levels throughout the day to make sure that they're still within the target range. So you want to bring their blood sugar down, but once the blood sugar is down below 5 millimoles per liter, or below 90 milligrams per deciliter, then that's great. I mean, you don't need to bring it down to 3.2 micromole or millimoles per liter, where they're getting into this serious ketogenic state. You just want to get their blood sugar into the ideal range for health. So keeping an eye on that blood sugar is very important. The American Diabetes Association recommends testing for ketones if the blood sugar is higher than 240 milligrams per deciliter. So again, in diabetes that's out of control where the blood sugar is high, then the person needs to be with their little dipsticks looking at their urine to see if what their ketone levels are. Because diabetic ketoacidosis is a medical emergency, patients should be warned if they are experiencing symptoms of ketoacidosis. They should see a doctor immediately. So some of the complications are that they can go into a diabetic coma just because of the acidity building up in their bloodstream can change the blood pH. Some of the warning signs of diabetic ketoacidosis include consistently high blood sugar. So this is in uncontrolled diabetes now. But in the person who is using a ketogenic diet, you want to be looking for dry mouth, frequent urination, nausea, fruity breath, breathing difficulties. The person starts to feel very weak and faint. You do need to keep an eye on them. They should be looking at their ketone levels to make sure it's not excessive, but really monitoring their blood sugar throughout the day to make sure it doesn't go down to something that's ridiculously low. That's where the danger begins. So when we look at the research on the ketogenic diet and diabetes, in 2008, researchers conducted a 24-week study to determine the effects of a low-carbohydrate diet on people with type 2 diabetes and obesity. So again, we're talking about over the last 10 years roughly. These studies have sort of emerged. At the end of the study, participants who followed the ketogenic diet saw greater improvements in glycemic control and medication reduction compared to those who followed a low glycemic diet alone. So that's interesting. Then a study in 2017 found that the ketogenic diet outperformed conventional low-fat diabetes diets over 32 weeks in regard to weight loss and hemoglobin A1C. And a 2013 review reports again that a ketogenic diet can lead to more significant improvements in blood sugar control, hemoglobin A1C, weight loss, and some of these people were able to discontinue their insulin if they had been type 2 diabetics initially, then they needed insulin, and now they don't need it anymore. So I think there's some real hope here that using a prudent approach to a higher protein ketogenic type diet can actually benefit these diabetics if the monitoring is done properly and you're very, very cognizant of these sort of renal and hepatic monitoring that's required. Other beneficial effects: there is research that supports the ketogenic diet for diabetes management, while other research seems to recommend the opposing dietary treatments like a plant-based diet. So there is evidence that just switching a person to a plant-based diet, something like what we call the portfolio diet, where the person's having beans and peas and soy products and lentils and lower glycemic vegetables. So it's sort of a vegetarian diet, but it's keeping the starchy carbs out and the refined sugars out, and it's using soy-based products for a lot of the protein in the meal along with beans and peas. That's been shown to lower cholesterol and to lower blood sugar, to reduce hemoglobin A1C, other cardiovascular risk factors, reduce inflammatory markers. So it doesn't have to be, eating lots of meat and, just restricting carbs. People switching to a plant-based diet, if it's the right plant-based foods, you still see some very good effects. So there's different ways to approach that type 2 diabetic. So you have to look at the person's, what they're willing to do, what is their orientation towards all of this, and what's their liver and kidney function, how might you best approach it. So there's no one standard way, I think, to deal with this. When we come back after the break, I'm going to show you some incredible evidence to show where in diabetics that have chronic kidney disease, where certain types of dietary manipulations along with certain supplements have been shown to actually help preserve or reverse some of the kidney decline and help to manage the diabetes. So where you have this sort of complication of chronic kidney disease in the diabetic, some new studies showing there's a way to manipulate the diet that can help to bring some of the kidney function back, and there's some certain supplements when it's combined with that diet that have been shown to also be helpful. So that's also very groundbreaking, something I want you to see. So we'll pick it up there when we come back after the break.